Okay, we're talking to Paul Boden about the organization that he directs called W.R.A.P, Western Regional Advocacy Project, and some of the artwork that he and Art Hazelwood put together for the recent show, HOBOS to Street People. And he's going to talk in particular about this piece by Claude Moller, who created this. He's an artist that works with San Francisco Print Collective.
Right.
He created this piece to illustrate a chart that Western Regional Advocacy Project put together. Would you like to hold up the chart? Just hold it up here. That's good. That's good. Notice how this chart is based on statistics, and what Claude did was to create a piece of artwork that really illustrates in a much more interesting way this chart. So, Paul, Paul Boden, would you like to please talk about this painting, which is called Housing Crisis Condition Critical, as it relates to this chart?
Yes, well, this piece, as well as a couple of others in the show, were taken from a report that was done by the Western Regional Advocacy Project entitled Without Housing, which showed the direct correlation between these massive cuts to affordable housing programs and the advent of contemporary homelessness. This little red line is funding for homeless programs from the federal government. This dark blue line that you see going from $78 billion a year in 2004 down to $18 billion a year in 1983.
Where's 1983?
And now, right here at the very bottom of the pile. And
this drop, then,
that
this precipitous
drop is billions of dollars of affordable housing funding for from the federal government, from Housing and Urban Development. And this point in time in the United States is when emergency shelter programs started opening up across the country in rural and city and suburban neighborhoods.
Right.
Now, it took till 1987, but since 1987, this little red line is the funding streams from the federal government for homeless programs. And you see this line going up, and you see this line bottoming out, and there's no attempt to close this gap.
So taking a look at Claude Moller's painting, which is called Condition Critical, he's created a chart that shows a flat line. It's would you explain that in the?
Well, the flat line is this most current period of time prior to the release of our report in 2006.
But the whole line is an EKG.
The flat line.
Right, the whole
Well,
line.
a flat line on an EKG machine means you're dead.
Yeah.
It means you're in critical condition.
Down here.
And, what we see is our affordable housing programs are dying. They're in crisis. And our homeless program is growing.
Mm-hmm.
And that's exactly what is the exact opposite of what we've been calling for. This poster was done in the spirit of working with the National Healthcare for the Homeless Council, which was one of those unfortunate national organizations created specifically because of the advent of contemporary homelessness. And it's made up of medical professionals and social workers and advocates that are working every day to take the need for a healthcare for the homeless program and end it. They want the affordable housing programs funding restored so that their clients don't have to be living out in the street and dying in the streets of America. And they're an organization that we're proud to work in partnership with, and that this poster was created for their 200 local health clinics to be able to have a poster that they could relate to, that took the issue of affordable housing and homelessness and brought it into a healthcare community in a way that they could relate to. And using an EKG machine was a brilliant way for Claude to really bring to life in for that community of people the relationship between a health crisis and a housing crisis.
Oh, that's excellent.
And the impact that that has on families and on people across this country.
And where is this organization located, Paul?
Their main office is in Nashville, Tennessee, but they have, as I said, over 200 healthcare clinics. Healthcare for the homeless is a very, it's a group of health professionals that are very committed to trying to stop the numbers of people that are dying in our streets every day, the numbers of mentally ill people that are living in alleys or locked up in jail, that are really trying to see that healthcare is a human right, and are obviously very tied up in the battles going on around healthcare reform now, to ensure that the poorest of the poor and immigrants that may not have the right papers aren't denied healthcare, vital healthcare, because of their poverty or because of their disability or because of their ethnicity.
Would you say that it's true that lack of housing leads to deaths?
Absolutely, lack of housing leads to death. I mean, obviously it does. And if anybody thought for a second that it didn't, they're absolutely delusional. But I think the most obvious statement in all that gets lost and that this work brings to light,
the artwork
brings to light, is how homelessness is a status of being without housing. It is not a disability. It is not a diagnosis. It is not a life skill issue. It's a state of being without housing. And if you restore the housing, unfortunately, you're still going to have poverty. You're still going to have racism. We're still going to have education issues that we have to address. We're still going to have living wage issues that need to be addressed. But what we're not going to have is homelessness. And the homeless debate needs to be centered around making sure that nobody goes without a home. And as soon as we achieve that, we'll have seen an end to homelessness.
And here, in this chart, you were talking before about filling this gap, raising the funding back up. Can you talk a little bit about that?
When we had the appropriate funding levels, or at least when we had much higher funding levels than we have today, we did not have emergency shelter programs across this country. We did not have health care for the homeless. We did not have the Interagency Council on Homelessness. We did not have 486 10-year plans to end homelessness, nor the 280 5-year plans that were written before that, all coming from different local communities.
What did we have?
We had housing. We had housing issues, and we needed to improve that housing. Instead of doing that, we eliminated the funding for any housing whatsoever.
Affordable.
And have put people into a place where if you can't afford to buy it, or if you can't afford to rent it, too bad, you're on your own, get out in the street. And that's killing people. It's been killing people for the 27 years we've been trying to end homelessness, theoretically, in this country. And why it's not working in the attempts that we're making is because what we're doing is we're doing public relations campaigns, we're doing neoliberal policies on the backs of poor people, and we're blaming poor people for the fact that they're homeless, and we're throwing them in jail for being so. Once we get the direct connect that housing and the cuts to affordable housing programs is what caused contemporary homelessness in the 1980s, and we restore that funding, we will see an end to contemporary homelessness in the 2000s.
I love your passion and the way you talk about this, and maybe we can connect that with the next painting, which is how many people do you need to start a revolution?